Millions of Americans suffer from migraine disease, but now an innovative and drug-free treatment options making it easier for people to access the care they need without the side effects of traditional medication. Joining us to talk about this is neurologist and migraine specialist Dr. Aliya Frederick, along with patient advocate Sarah Aaronion. So, Sarah, I want to start with you. I know that you have been living with migraine disease for years now. Can you talk about the impact that traditional treatment options have had on your daily life?
Yeah, it's a huge impact because you're worrying every day about if you're going to have a migraine when you're at work or when you're at school or hanging out with friends or even driving, which is a huge issue. And it just, systematic side effects of traditional medication are like drowsiness and confusion, and it doesn't really make you feel very confident in your daily life. And I needed something that wasn't going to affect me.
Well, Dr. Frederick, how are drug-free treatment options really changing the landscape of migraine care?
So what people should know is that drug-free treatments are necessary for some patients and really provide significant benefit. Many patients and families actually seek out drug-free options due to concerns about systemic side effects, like Sarah just mentioned, or they simply just don't want to take a medication. And we do see low adherence to daily preventive medications due to these concerns. The Nerivio wearable is the only drug-free option available for both preventive and acute treatment in individuals as young as 8 years old. And we do know that prevention is critical for reducing the long-term disability related to chronic migraine.
So, Sarah, how have these new treatment options changed your experience with migraine disease?
Yeah, it's, again, like I said, I was afraid to go out with my friends because I was constantly worrying about a migraine. And now that I have a drug-free option, it makes it a lot easier. It makes me feel a lot more free and a lot more confident. The only issue was when I first started with Nerivio, I had to pay out of pocket. It became kind of a financial burden for me. But I called and I advocated for myself, and I told them, hey, this is probably a good option. And now my insurance is covering it.
Well, speaking of advocacy, Dr. Frederick, why is patient advocacy so important when it comes to improving access and affordability for these alternative treatment options?
Yeah, this is a great question and so very important. I truly believe that we have to eliminate barriers and increase access to effective treatments and affordable treatments for equitable healthcare. For the Nerivio wearable, patients can advocate by calling their insurance companies, writing letters, sharing their stories with their healthcare providers, and their healthcare providers can also advocate by contacting insurance companies and sharing these stories and real-world efficacy data. And this is something that I personally do. The good news is that more people are getting access to Nerivio wearable. There have been some recent announcements regarding some insurance company increasing their access, their coverage, which is fantastic. We are gaining some momentum in this area, but we still do have a long way to go.
A lot of great information here. Where can we go to learn more?
Absolutely. We would love for you to visit neriviocover.com, where you'll find more information about the treatment and also resources to help how you can help advocate for coverage.
All right, Dr. Frederick and Sarah, thanks to both of you for being with us today.
Thank you so much.
Thank you.